I'm a surgical tech. I've been a surgical tech for 23 years and I still love it. I look forward to coming to work every day. I'm in a position where I am able to make a difference in how the procedures go and anticipate the needs of the surgeon and the needs for the procedure. So that's a great feeling that I go home every day and I know that I can make a difference. So.
Right, very good. So I have a few questions for you. The first one would be, what challenges did you look for in this certified technologist job?
What challenges do I look for? I've trained myself to focus, and that's one. It's not always exciting, and so, but we do have to keep our eyes on the field and what's going on, and so it's a challenge to make myself focus. Stay in the moment, in the need, not get distracted by what else might be going on in the room, and I think that can make a big difference between a really good surgical technologist and someone who's just kind of there,
Right, good. What is your biggest weakness?
As far as procedures go, probably ENT, because I don't do a lot of it. I do a lot of ortho, which a lot of people are intimidated by, and so I do get put in there a lot. So when I get put in an ENT room, it's not my strength, but I know who to go to get the pointers I need to make sure that I'm going to be able to do a good job that day.
Okay. What have been your specific duties as a surgical technologist in the past?
So my job is to make sure that everything is there that's needed for the procedure, and there's a preference card that we use that tells us what each individual doctor wants and needs for that procedure. But over time, my experience also tells me that there may be things that aren't on the card or that may be needed, and so if a laparoscopic gallbladder turns into an open gallbladder, do I have what's needed there for the just in cases, for just in case this happens, or or that this might be needed, so that's how I prepare for that, and then also, I assist the RN in the room and getting the patient ready, and then afterwards the care and maintenance of the instrumentation.
Working as a surgical technician, one can come across many situations of emergency. How do you handle the stress?
One thing that I do a lot of training. I'm also the lead preceptor here. So one thing that I tell people is always set up as if it's an emergency. Always push yourself to get faster, better, more efficient, so that when you do come into that situation where you're in an emergency situation, it's not a big deal to you, because this is what you've pushed yourself to do every day, is to do it quickly and be ready. Because our job is to be ready for whatever that surgeon might need. We're thinking ahead. Okay, if there's bleeding, what do we need? If there's, what is it that I need to have next in my hand? I should always be thinking, what's next? What's next? What's next?
Right, very good. How do you handle being put into a room with a surgeon you have never worked with, or surgeries you have never scrubbed?
It's important that the surgeon knows where you are in your experience. That everyone in the room knows where each other, where each of us are in our experience. So, let's say I'm put into a laparoscopic appendectomy. I've done a laparoscopic chole. Maybe I haven't done a laparoscopic appendectomy. I let the surgeon know that. I'll let the surgeon know that I've read your preference card. I've asked someone who works with you often, and I've done these procedures which are similar, and so I believe I'm ready to do this case. But if you have any suggestions, or help me think ahead, so they know where you're at, and that you can overcome any challenge in that way.
Right. What is your favorite specialty?
Orthopedics. No hesitation.
Nice. How well do you work under pressure?
Very well. This job trains you to do that.
Right.
To keep your calm, to because my stress level is going to affect the surgeon's stress level, and it's all about the patient. Everything we do is about the patient, and so whatever I can do to keep my surgeon focused on what he's doing and not having to worry about what he needs next in his hand, I'm going to get it there. He doesn't have to worry about that, or
Right.
she.
Okay. What are some of your favorite cases?
I like total knees. We've started doing anterior total hips here, which is something that not everybody does, and so I really like being part of that program and being able to make a difference there and set a standard. Basically everything orthopedic, but I like general surgery too. It's just orthopedics is my favorite. Total knees is probably my favorite.
Right. Okay. How do you handle difficult doctors?
Respect and patience.
Right.
It's always treat others as the way you want to be treated. If that doctor's having a bad day, he might take that out on me. I see that as his problem and not my problem, and I'm still going to give the best assistance and care that I can, because it's not about that doctor,
Right.
it's about that
the
patient.
Right. Okay. Last question. What made you decide to become a surgical technician?
I went to school at Sterling, and so I was in the health program there, and I thought I wanted to be a radiology tech. And so I went to the first semester of radiology tech school, and one day we went up to the OR. And I had been kind of thinking, once I learn all these poses, what else is there, for taking the pictures with X-ray. And X-ray does have other things you can go on and do, but we went up to the OR, and they were doing an orthopedic procedure, and I was like, what is that job?
Right.
That is what I want to do. And so I changed, and I went to San Jack, and I've never regretted it. Never regretted it.
Wow.